Hey guys, welcome back to the Dental Debrief, where we discuss all things dentistry. My name's Maheer, this is Tim, and we run a clinic called Azure Dental out of Perth, Western Australia. So today we're going to talk about how your oral health affects your overall health. So how does that happen, Tim? How does this little part of your body affect your overall health, or overall well-being?
Yeah, so I think there's two elements to it. The first thing I think is that more and more science is showing us that inflammation is a cause of a lot of problems. So like those classic chronic diseases like coronary artery disease, heart disease, diabetes. All of these things are inflammatory based. So the more inflammation you've got in your body, the more at risk you're going to be of getting these things. And your mouth is attached to your body. Gum disease is inflammation, gingivitis, periodontitis. All of this is adding to what they call your systemic inflammatory load. We want to keep our inflammation as low as possible. So it makes sense that having a healthy mouth is going to be better for the rest of your body. The other thing is that in our mouth, we've got a lot of bacteria. And when we're chewing food, brushing our teeth, flossing, anything like that, and we're causing these little micro traumas, we're getting bacteria going into our bloodstream. The other place where this happens is when we go to the bathroom. Okay, so that's the other time when you can get little tears and the body's exposed to bacteria. So those bacteria get into the bloodstream and can lodge on heart valves and things like that. They find them in like atherosclerotic plaques, so plaques in the blood vessels. They find oral bacteria inside them. So the more bacteria, the more disease you have in the mouth, that's the more bacteria getting in your bloodstream that can go on and cause issues in the rest of the body. Maheer, from your perspective, how can your mouth affect the rest of your body?
So definitely agree with everything you said. The whole body's connected. We're kind of like a tube. So the bacteria that's in your mouth is sort of going to be in the rest of your body as well. But there's also the social aspect that if you can't feel confident to smile, or you're afraid of your gum disease or your breath or your smile or the shape of your teeth, whatever it may be, and you can't express yourself, I think there's a big emotional impact to you and your sort of just your well-being of your life. You could be the healthiest person, but if you can't express your joy and your happiness, or you don't feel confident to be social, you're not going to be a happy person.
That's a really good point, yeah.
So Tim, any signs, any symptoms that you could find in the mouth that could indicate something more serious is going on?
Yeah, I think the classic one is gum disease. And whenever people have gum disease, we always ask about diabetes, because diabetes, it affects your immunity and it also affects your tissue's ability to heal. So we find that sometimes these patients who come in with a lot of gum disease and gum abscesses and things like that, they have undiagnosed diabetes. So I think that's a really, really big one. And the interesting thing is that the research shows that for diabetics, if they can control their gum disease, their blood sugar control gets better. And it seems to be just from reducing the inflammation in the mouth, seems to have a positive effect on the diabetes. The other classic one is, you can get all sorts of unusual conditions in the body affecting the gums as well. The classic one is leukemia, which can cause really bad gingivitis that doesn't resolve and that it's not proportional to the amount of plaque there. So there's all sorts of sort of weird interactions that you can get with these other conditions.
Yeah, we also find like viruses are now create gum problems. You have all kinds of other pathogens.
Yeah, I think at the moment there's actually a syphilis outbreak in Perth, and we just got an update to look out for syphilitic lesions in the mouth, on the tongue, and the roof of the mouth, because they're like really classic location for those lesions. And yeah, it's an unexpected one. Yeah. Are there any groups of people who you say are going to be a little bit more at risk of getting sort of issues in their mouth because of medical conditions that they've got?
Yeah, so like you mentioned, diabetes is a big one we find and we pick up in the mouth. So if you have a family history of diabetes, that's really common to look for.
I think the other big one is the medications causing dry mouth.
Yeah, so that saliva is so important in your mouth, and that's protecting your mouth. So we have a lot of medications really commonly prescribed that you use daily, even with kids now, that really slow down that saliva production and really dry the mouth. And that we find really increases that risk for decay, cavities, and gum disease.
Yeah, I find it's blood pressure medications, especially ADHD medications, and a lot of psychiatric medications as well. They really dry out the mouth, and I find that if the saliva goes, you can go from a perfect mouth to decay in every tooth in 6 months. It's crazy.
And the decay spots are like in the randomest places as well, where you never find decay.
Exactly.
And it really breaks these teeth down. So Tim, has there ever been a moment where you've found that connection between oral health and systemic health as well?
Yeah, definitely. I think as soon as you're doing surgery, you really start to notice the differences between people in terms of the healing. The big one is sort of implant surgeries. And you learn about it in uni, you know, people with compromised immunity, diabetes, they're always going to be more at risk of things not healing properly. But you don't fully appreciate it until you get out there and you think, oh, you know, those patients are a minority, but they're not. In our population, there's such a huge number of people with a lot of medical conditions and diabetes and things like that. And when we do go to do implant surgery on them, you notice a significant difference in the healing and in implants being rejected and things like that. And that's why now, I mean, a lot of our patients who want implants, we have to look at their blood sugar control first. And if it's just off the charts, we just won't do it until the number's down into that safer level, because the difference is just so profound in terms of their healing.
Yeah, wow.
What about you, Maheer? Have you had any other situations where you've seen systemic health affecting the oral health?
Yeah, I think it's like what you mentioned with the medications. So patients come in, dry mouth, heaps of cavities. So you plan all these restorations, you plan all these appointments, you fill all these holes, and then they come back in 6-12 months later and there's decay around all the fillings. And that's just because the mouth's become so acidic from all the medications and the poor saliva. So it doesn't matter the treatment that we're doing, it just fails and doesn't last. Yeah. And then what do you do after that? You know? Yeah.
I think the key thing is you have to manage the underlying problem first. So if they do have a dry mouth causing decay, then just filling the holes is just a kicking the can down the road, because you're right, if you don't fix what's causing the dry mouth, everything's just going to be decayed again in 6 to 12 months. So it's super important, because there are a lot of ways that we can manage these things. We can change medications, or if we can't change medication, we can use saliva substitutes. There's all sorts of things that we can do, but you just have to be aware of it and talk to your dentist.
Anything you've actually caught in the mouth that's been like a real shock and a real picture into their systemic health that you were just not expecting?
Look, over the years, every single patient we're looking for oral cancer, and I've definitely picked up my share of oral cancers over the years, and some of them in really initial stages. And by picking them up early, it was just a simple excision and the patient's fine. So that's always the big one, because these are things that can really affect people's lives. Yeah. What about you? Have you had any situations where you've found things in the mouth that are a sign of underlying issues?
Yeah, similar. I've found just routine x-rays, and we weren't even sure if we were going to do a full mouth x-ray that day. I was like, let's just take one. And we found a huge cyst that had just been growing in the side of this patient's jaw. And he's like, area's been feeling weird, tooth's become a bit loose. And we just found a massive space of fluid sitting there that looked benign, really.
And those patients are often the ones with those cysts in the jaw who they only find out about it because they take a hit in footy and fracture the jaw, because the jaw is so thin because of the presence of these cysts. And they're, I wouldn't say they're super common, but we pick them up on the regular, Thanks everyone for tuning into another episode of the Dental Debrief. And if there's anything you want us to talk about, just leave a message in the comments below and we can get onto it in a future episode. And I'll just leave you with a final thought. I think in dentistry, there's a lot of treatments available, but everything comes down to prevention. The most important thing is just preventing problems before they occur. And it's important for patients to know that, but it's also really important for dentists to approach their job with that attitude that prevention is better than cure.